Holly, and I made the terrible mistake of getting a discount strip mall boob job. I'm from Springfield, Illinois now, but I'm really just a small town girl. I grew up in a town with about 1,000 people in it. My dad was a farmer and my mom worked for the state. In high school, I was a cheerleader. I dated the high school jock. I married him when I was 20 years old. I had my first child when I was 20. I was 22 when I had my second child, so I got married young, had babies young. Small town girl. After I had finished nursing my daughter, I was only able to nurse out of one side, so that breast was very low. My husband, he would make comments about my breasts, and it would make me feel bad about myself, so I decided that plastic surgery was the only thing that was going to help me feel good about myself again. I had just started my career, so we didn't have a ton of money at home. It really was just calling 5 or 6 different providers, and then I made an appointment for the cheapest one. My mom and my husband at the time went with me to the first appointment. It's in a strip mall, kind of secluded. There's a convenience store there. We walked in and I didn't really feel comfortable, but I didn't know what to do because I really wanted to have them done. I thought maybe this wasn't the best option, but it would get the job done for a price that we could afford. The day of my surgery, they took me back to a recliner that I sat in, handed me a cup with like 3 or 4 pills in it, and told me to go ahead and take it. And then the next thing I know, I'm waking up all taped up. I feel like an elephant's on my chest. And that was probably the first time that I was really like, oh my gosh, what did I just do to myself? I went back for my first checkup 7 days later, and they already looked very uneven. And he told me that it was just the swelling and that with time it would go down. But they never improved, and I just realized that there was nothing I was going to be able to do about it. I was trying to raise the 2 young kids. I was unhappy with how I felt. I think I was projecting a lot of that onto my marriage. Ultimately, it didn't work out, and we got divorced. I remember one of my girlfriends saying, whenever you decide that you want to date again, I know somebody that has a crush on you. And, when I asked her who, she said Jeremy, and I was like, he's cute. Jeremy proposed to me after we had dated for a year. We got married 3 months after that. Now we share 2 children of our own. We have 5 altogether with my other 3 from my first marriage. Thank you.
You're welcome.
That was a good run.
Yeah, hot one. So what do you think about the consultation?
I'm excited. It's something that I've obviously wanted for a very long time.
Since we've been together, it's bothered you.
Yeah.
Holly is the best mother in the world, the best wife in the world, but I know that deep down inside, it really affects her. And so, I want this for her for that reason. I just want you to see the beauty in yourself that I see in you.
Aw, thanks, love.
Holly is our next patient, and Holly had 1 breast surgery. 1. Pretty simple breast augmentation, right? Not so simple. Look.
Holly's breasts look like she's had 5 or 6 surgeries. She's only had 1. What type of doctor did this surgery?
Is that a deflated implant?
I don't think so. First of all, major asymmetry.
Yeah.
Both going down, one going down much worse than the other. There's a lot of questions we need to ask Holly. Could you ask Holly to come in, please? Let's get right to it.
Sure. Please send in Holly.
Holly.
Hi.
How are you?
Hi. Nice to meet you. Good.
Dr. Nassif.
Hi.
Terry Dubrow, how are you?
Hi. Good. Nice to meet you.
Jeremy.
I really hope that the doctors have some knowledge of what's going on with my breasts today, because I feel like I'm just really in the dark on what the problem even is with them.
So, Holly, tell us how this happened.
I was just young. I had 2 small children, so I was looking for the cheapest option possible, basically. That's how I ended up at a strip mall.
And the surgery was at the office?
Yeah.
In the office?
Yes.
The fact that it's in a strip mall probably indicates that it's sort of a lower rent district and may not necessarily comply with the high standards that we have in American medicine.
I had a bad feeling. If being older now, I never would have gone back after the very first consult.
You're not a doctor, you're
Yeah.
not a plastic surgeon, I totally understand. If that little voice in your head is telling you that it's not a good idea, sometimes you really need to listen to it, because that voice may save your life. What do you think of this situation?
I don't think she needs anything done, personally.
I love that answer.
But I know this is something she wants to get done, and I know it'll make her feel better, so I'm here to support her.
Holly's husband, Jeremy, seems like a great guy. He's supportive. He's sweet, he's nice, he's just there to back her up, and that is a good guy.
All right, well, we'll see what we need to do, and we'll know exactly what the options are after we examine you, okay? So why don't we go out there and have a look and see what's going on.
I've been waiting for this surgery for almost 10 years now, and just kind of putting my needs and my wants on the back burner to do what's best for the kids. So I really hope that they think that there's something they can do to make my breasts look normal again.
Let me see what's going on.
All right.
Sit forward a little bit. Okay.
So you can just see the whole saline bag.
Right, so...
She's got ulcer rippling here.
So do me a favor, put your hands on your hips and push here. Push. Huh.
That's not under the muscle, is it?
I don't think you are under the
I
muscle
think it's
at
just
all.
the contractions lifting it up.
Well, if this is true, if you're not under the muscle, that was a big mistake.
Yeah.
This is a little bizarre. Now, your asymmetry on your left, you're about 22 centimeters, which is not too bad, although this nipple goes down a little bit.
Yeah.
And on the right, you are 25 centimeters. So that's a significant asymmetry. The more asymmetry you have preoperatively, the more difficult it is to get the patient even postoperatively. Holly has a 3 centimeter difference between one breast and the other breast. This is not going to be an easy procedure to make her look even. You have saline implants on top of your muscle, very thin skin, very little breast tissue, a pocket on the right that is way too big, and droopiness on one side much more than the other. We're used to complicated problems.
Okay.
This is a complicated, although fixable problem, but the number one risk we worry about is the loss of the nipple now, okay?
I obviously like my nipples. I don't want that to happen, but I think that he's going to do whatever he can to prevent that from happening, and I just have to put my trust in him. I have faith in you.
Yeah.
Right?
Good.
Yeah.
You're gonna need to have faith, right?
I think that makes me feel good.
Pleasure.
Thank you, doctor.
Thank
Thank
you.
Hello. Hi, Holly. Here to check in for surgery with Dr. Dubrow.
Okay, go ahead and sign in and we'll get you taken right back.
When I had my last surgery, I felt very uneasy basically from the get-go. So I feel so much more at ease with Dr. Dubrow. And I still have the butterflies and I'm anxious because it is still a surgery, but I definitely feel like I'm in good hands with him.
First of all, how are you?
Good.
You in the mood for this? Are you psyched?
Yeah.
Are you nervous?
Yes.
Are you nervous?
I'm probably more nervous.
And I'm probably the most nervous.
Well, perfect.
Just
right?
kidding. You know, I'm going to use every tool in my toolbox to give you the best result possible, you know? My plan for Holly today is to first remove her old saline implants. Next, if my suspicions are correct and Holly's implants were put over the muscle, I'll need to elevate the muscle up and put a brand new pair of silicone implants under that muscle. Lastly, I'll perform a lift and an areolar reduction to the right breast to get it symmetrical with the left breast.
Hello.
Holly, how are you?
Good.
I'm still recovering from your surgery. I'm not kidding.
Uh-oh.
I've been in bed ever since I did your operation. So how do you feel?
I feel good.
Yeah?
Yeah. I'm not in too much pain. Really, the drains that are on my sides are kind of tugging a little bit, but I have pretty high pain tolerance, so the pain is okay right now.
So there it is.
All right.
There we go. That's nice. There we go. That's really nice. Yeah, you're healing very well. Interestingly, I've made almost every surgical maneuver you need to make to fix someone's breasts, and Holly is acting like I did very little. She's healing really well, and I'm a happy man today. What was challenging on this side is that the muscle was against the chest wall, and once I lifted it up, it was so scarred in that it just pushed down on the implant, and basically it was like this. I lift up your muscle, and it did this. After an hour and a half of trying to negotiate that muscle, and it gave, and it was like, hallelujah.
If they didn't get any better than what they look today, I would be completely thrilled. So I can't wait for a few weeks down the road whenever the swelling's gone down to see how they actually look.
So let's get you home to your kids,
Yes.
and get you recovering, and go from there, okay?
Perfect. I'm so excited to be here and go rock climbing with Jeremy today. Back when I was 22, I was not in a good place in my life. I was struggling in my marriage, and I wasn't happy with how my body looked. So I made the mistake of going for the cheapest surgery possible. I got discount breasts, and boy did I pay for it. I was in pain all the time. When I look back at where I came from and where I'm at now, it's just unreal. I have a great husband, I have 5 beautiful kids who I love more than anything, and now I don't have this body image issue that's just weighing on me. There's no pain now, I have no problems anymore, and I get to wear cute clothes to go rock climbing.
I'm so anxious to see Holly. I don't know what she's gonna wear, and the anticipation is killing me. Hey, what took you so long?
I had to get print. What do you think?
I think you look amazing.
Well,
Very
a
nice.
lot different than what I used to be able to wear.
Yeah. Holly would have never worn the outfit that she has on today in the past. It's great to see her comfortable with herself. She has this air of confidence about her, and it just makes my heart smile.
Coming? Yep. Before I had my surgery, my breasts were very uneven, there was rippling, and I had terrible, terrible self-esteem. But now, my breasts feel like they belong on only my body, they're even, there's no rippling, and I couldn't ask for anything more. Good job.
Good job.